Welcome. My name is Amanda Gunter, and I'm one of the directors here at Brain Balance Achievement Centers. And I'm so excited that you guys have taken the time out of your evening to join us for a webinar. Tonight, we're going to be discussing ADHD and behavior and the impact of brain function when it comes to the diagnosis of ADHD and also children that are struggling with behaviors. The next thing is I want to introduce you to our guest speaker tonight. Her name is Dr. Michelle Robertson, and she has spent her professional career helping others improve their lives and is dedicated to the Brain Balance program. Dr. Robertson has over 20 years of professional career that includes numerous peer-reviewed publications, dozens of professional workshops, trainings, and presentations around clinical practice. She actually has co-authored a research study on the impact of the Brain Balance program on children's emotional well-being. She's a tenured professor with a Master of Science in Family Therapy with Friends University, and she's earned her doctorate in marriage and family therapy from the University of Louisiana. I'm so excited to have you on tonight, Dr. Robertson. I want the audience to hear your story on how you came about related to Brain Balance, and yeah, please share with us.
Sure. Amanda, thank you so much, and all the directors who've joined tonight. Thank you for inviting me to be a part of this. I appreciate the introduction. What it boils down to is I've spent my professional career investing in families, and that's what I set about to do early in life, and I've been able to do that. I teach at the university where I teach. I train master's students and to be clinicians. So to do what I do, that's how much I love what I do. I did not go looking for Brain Balance. I had met all my professional goals, was doing, teaching, have a practice, supervising clinically. Brain Balance found me, and I have to pay attention when things find me. One of my graduates found me a couple of ways. One of my graduates about 10 years ago finished the program and got a job in the Kansas City Metro at a therapeutic boarding school as a clinician. And I was her postgraduate clinical supervisor, which meant that I was responsible for overseeing her caseload, her treatment, tracking progress, making sure until she was independently licensed that she was providing good care. Part of that therapeutic boarding school is an integrated Brain Balance program. I didn't know anything about this at the time. All I knew, some program, parents had the option to enroll their child in while they were at the school, and some didn't. So about half of my supervisee's caseload included kids who were going through Brain Balance and about half who were not. I can tell you it did not take very long supervising her caseload to notice a stark difference in the progress that the kids were making in her care who were going through the Brain Balance program simultaneously. They were leaps and bounds ahead in learning emotion regulation, beginning to develop empathy where it had not been developed, making better informed decisions, less impulsivity, far less disruptive, difficult behaviors, and they were increasing their academic performance. And I thought, well, what in the world is this thing that is really enhancing what I've, spent at that time 15 years trying to teach others to do? That and watching one of my own extended family members go through the Brain Balance program in another state and putting those two things together, recognizing we're talking about the same program. That was bizarre. And that set about 3 to 4 years worth of investigation on my part to decide whether, what is this Brain Balance thing? Does this align with what I know to be true about brain science and brain development? And is it something that I feel like I could put my reputation really on the line for? And there's no question, everything lined up as I moved through that process. And my business partner and I then opened, a little over 5 years ago, opened the center here in Wichita, Kansas. And we've since had the Nashville market. So there's a Nashville center there in Franklin, and then Minneapolis in the Woodbury suburbs. So to say that I love this work and how it ties into, what I've spent my life doing and how it enhances, I can't even begin to tell you. So Amanda, to be here tonight to talk to these families who are struggling, to be able to offer anything from my own professional experience that could help them I'm excited to do. Thank you so much.
I'm so excited that you're here. And the other thing is that the specific program that you teach, you guys specialize in neuroscience. Is that correct? If I remember correctly.
Yes.
Yeah.
It is. It was a new thing 25 years ago. But when I got here almost 19 years ago, my colleagues, introduced, hey, we teach therapy, but we do so from this thing called a neuroscience standpoint. I'm like, a what? And so across the last 19 years, being able to see the integration and teaching our students how the brain works so they can understand how to help people. It's not just talk therapy in that sense. We're teaching brain development. It's been an enormous asset to my career. And then Brain Balance has enhanced that further.
That's awesome. That's awesome. Well, so tonight, again, most of the time when families are tuning in to a webinar about ADHD and behavior, many times we hear from parents the behaviors that are impacting their family. Several times we hear that children are struggling with being impatient, being impulsive, having meltdowns, being defiant, being quick-tempered, emotional outbursts that come at a quick, all of a sudden moment where things could be great one moment and then something happens and then they are not great in the next moment. And really tonight we want to talk about, okay, if a child is struggling with behavior, it impacts several environments. It can impact the home life, it can impact school life, it can impact the ability to go out in public. And so one of the things that we look at and we ask families are you seeing behavior in multiple environments? Because oftentimes that tells us something. That tells us something around their brain and the way their brain is functioning. Behavior absolutely can impact relationships with siblings. It can cause shame. In the essence of that, parents, we hear all the time parents saying how they're embarrassed about how their child is acting in public. Of course, it impacts marriages. It causes high stress. And they're just constantly walking on eggshells. Dr. Robertson, share with me what you hear in your practice around parents that are really struggling with children that have behaviors.
That's been the bulk of my clinical work, is with adults, with the parents. I have not worked directly with children in my professional practice, which I will offer a thought about later on when we talk. But parents come in and they're oftentimes they're on opposite ends of the spectrum. We have one parent who wants to view the child's behavior in a way that would suggest the child is doing it on purpose. And that if only we were harder on them, if only we had more clear boundaries and firmer, punishments or more harsh punishments. And then the other parent is often maybe leaning in the other direction, and that polarizes parents. Well, nothing will hurt a marriage faster than polarized parents in that realm that disrupts their marital discord, and then they begins to disrupt their relationships with that child, any other children in the family, because they don't see eye to eye. I tell people, one of the phrases my colleague likes to say is, if all you have is a hammer, everything looks like a nail. When, as a parent, you view your child as doing something willfully or on purpose or manipulatively, then you are going to respond to that child in a way that says they need correction, and sometimes harsh correction. If instead they could see the child's behavior, which is more accurate and likely to be an anxiety or a fear, how differently would parents respond if they could see the same behaviors and understand it as coming from a totally different place? The child is not inherently bad. Neither are the parents.
Yeah.
So parents often think they're bad. If my child is behaving badly, then I must not be doing this right. The truth is, children with ADHD do not quite literally have the pathways in their brains to effectively regulate emotions, to make good decisions, to learn from previous experiences. So those feelings like fear and anxiety, they come out in really disruptive, difficult, challenging ways. And that leads parents to not know what quite to do, which leads to marital arguments, relational discord, and disrupted family dynamics.
Yeah. So throughout the presentation, I always want families to just be able to have some takeaways. And I think one of the first takeaways we want you to have is that, number one, your child isn't bad. And number two, you're not bad parents. Many times parents that come into Brain Balance, they have tried everything. They've read all the parenting books, they've tried all the parenting tips, and they've tried it all, and I think what you're saying, Dr. Robertson, in the essence of that, when we have underdevelopments in the brain, which we're going to talk about that tonight, how, again, their brain can shift into that fight, flight, or freeze, where they are functioning out of fear, where they are functioning out of anxiety. And even though it's a safe environment, and even though, they're in a loving home, their nervous system can easily become dysregulated. And so we're going to talk tonight about why that happens and how that happens. But I really want, parents to have this takeaway that your child is not bad and that you are not bad parents. And hopefully that brings some relief. And as we talk more about why you're experiencing what you're experiencing, and then also what you can do to change and to improve brain function. So here's our next poll question. What is your greatest concern for your child or young adult? Is it that your child or young adult is struggling with challenging behavior? Is it more related to attention and focus? Is it more that they're struggling with anxiety, which you're concerned that that's going to impact their full potential? Or is it all of the above? Many times children can present multiple symptoms, and that therefore causes multiple concerns with parents. So again, we want to hear from you on kind of what is your greatest concern for your child? And let's see what you guys have to say related to that. I know sometimes it takes us a minute. All right, 50% says all of the above, and then 25% is struggling with attention and focus. So yeah, that makes sense. And so that's helpful. The other element that we talk about is just, what does the research say? Because one of the things that we're finding is that Harvard Medical School actually is sharing some research, more of the longitudinal research looking at ADHD and the seriousness of it as the child becomes older. One of the things that we often hear is that, well, my child's diagnosed with ADHD, in their elementary school level, and then they get diagnosed with anxiety, and then they get diagnosed with oppositional defiance, or, the diagnosis changes over time or can be added to multiple diagnoses. But what the research says is that anyone that is diagnosed with ADHD, that there is a higher incidence for personality disorders or mood disorders as they become adults, that they're at a 15 times increased for drug abuse. And talking about that boarding school that you shared about that has a Brain Balance, that's absolutely what we saw, is that our teenagers were utilizing drugs and alcohol as a coping skill. To mask anxiety. And then also too, that there's 125 times risk for institutionalization for delinquency, and that there's a 19 times risk for incarceration. So all to say that as the child becomes older, they are at a higher risk for, getting involved in other things. And it becoming more of a problem. Share with us, Dr. Robertson, what you see in your practice, because this is, this is more of the extreme, but what are like the everyday struggles? Because a lot of people are diagnosed with ADHD. So what are those everyday struggles?
Yeah, I mean, again, we even if as a child, an ADHD child struggles to sit still, in a chair, stop interrupting others mid-sentence, that may not be what ADHD looks like in an adult. And they may also, as you mentioned, not be, in trouble with the law. Instead, this can morph and translate into struggles maintaining consistent employment or even getting promoted for work because they struggle as an adult in the same way they did as a younger child with task completion and remembering and paying attention to the details. And then more in line with what I've done in my work with my adults is intimate relationships. Being able to develop and sustain long-lasting relationships is incredibly difficult for people who persist with these symptoms into their adulthood. They carry narratives around being bad or not being good enough, and then that begins to translate into how they interact and relate to others in their life long term. And that's really the saddest part for me, is knowing that they could have done things differently early on and that could have shaped so many things, even down to the types of careers they tend to choose because of the limitations of ADHD, and their capacity was so much greater than what they were able to do because of those limitations.
Yeah, absolutely. So we always like to be able to give the definition of what is the criteria for being diagnosed with ADHD. And so what the DSM-5 says is that people with ADHD show a persistent pattern of inattention and or hyperactivity, impulsivity that seriously interferes with functioning of or development. That there's clear evidence that the symptoms interfere and or reduce the quality of social, school, and work functioning. Now, what I always think is interesting with any diagnosis, if we really look at criteria, it's really around symptoms. And that's the reason why you can see diagnosis change over time, because the symptoms can change. And so we're going to talk tonight about, again, what is the diagnosis? What does that really mean versus what is the root cause of why? So here's our next poll question. Does your child have a formal diagnosis? Is it ADHD, oppositional defiant disorder, generalized anxiety disorder, or they're undiagnosed? Maybe you just have concerns and you're wondering if this behavior is quote unquote normal. Or maybe there's another diagnosis that we're not listing. But oftentimes, when we really look at the topic of diagnosis, it's really just a list of symptoms. And so if they meet the criteria, it's because these symptoms are present and therefore they meet the criteria. So let's see what you guys have to say related to specifically your child or young adult. All right, 63% are diagnosed with ADHD, but 34% are undiagnosed, but yet you have some concerns. And then the rest are 19% between oppositional defiance, anxiety, or another diagnosis. So here's where I want us to shift. We're just talking now about symptoms. We're talking about how symptoms can, land in a situation of having a diagnosis of ADHD. But as we look at the root of why, this is something that we look at Brain Balance. And I always love to use the picture of an iceberg, because it really gives us an understanding that what we're seeing is really just the tip of the iceberg. The symptoms that you're experiencing as a parent or as your child, and you're watching your child grow and develop, all of those symptoms are just what you're visibly experiencing and what you're seeing. No friends, losing things, impulsive, inattentive. The teacher saying, oh, if he's so smart, but if he would just pay attention and focus. too long of homework times, not able to complete assignments, completely disorganized, lack of self-control, having meltdowns. All of those things are just what you are experiencing. It's just the tip of the iceberg. But yet, what we really have to look at is how is your child's brain processing information? How is that processing happening? Where are their strengths in processing? And are there any weaknesses in processing that's really impacting the cross communication of the brain? And so we look at it from a few perspectives. The first perspective we look at is from a developmental perspective. So we look at, okay, how the brain should neurotypically develop. And the place that we start is all the way down at the bottom down here of what we call primitive reflexes. And primitive reflexes are involuntary motor responses, involuntary reflexes that are basically every baby that is born has them. Okay, they are survival reflexes because in a baby, their brain isn't fully developed. All right, if we think about only what I call the downstairs part of the brain is developed, which is the emotional area of the brain. And when we think about a baby, when they're hungry, they cry, right? When they need to be changed, they cry. They respond out of emotions because that brain isn't fully developed. And so these survival reflexes are present and they're active because it actually keeps the baby alive. It regulates heart rate, it regulates body temperature, it actually makes sure the baby's moving. If you actually watch a baby, they have these sporadic movements. Those are active primitive reflexes. But here's the thing. These primitive reflexes are present because the brain isn't fully developed. But then the brain begins to develop through sensory systems. So what your child sees, hears, smells, and feels, and through motor development. So, you think about motor milestones, right? The baby lifts their head, rolls over, sits up, crawls for 4 months, stands up and walks. All of these milestones are really critical, and they're critical because as the brain is developing, these primitive reflexes are inhibited, or the brain matures to where they don't need to have these primitive reflexes active any longer. However, many times children that are struggling with emotional regulation and they're struggling with behavior and meltdowns, many times we find that they still have some primitive reflexes that shifts their little brain from what we call parasympathetic response, which is rest and digest, and your body's in a state of calm and you're digesting your food and you're able to reason and critically think. It shifts them into more of that sympathetic response where they're in fight, flight, or freeze. It inhibits reasoning and critical thinking, and they're actually responding out of a place of emotions, and their nervous system is very dysregulated. And so many times, this is one of the first things we look for in a child that's struggling with behavior is we assess and look, do they have any active primitive reflexes that's inhibiting development of the brain and actually causing their brain to shift into fight, flight, or freeze? And so this goes to the point when we were talking about that your child's not bad, they don't purposely choose to respond this way. It could very well be that they have active primitive reflexes that causes their nervous system to become dysregulated, and then they're responding out of emotions and they're responding out of the downstairs part of their brain versus reasoning. Now, I know Dr. Robertson, we talked about how this was very eye-opening for you, right, as a clinician. Share with me your perspective and just how that impacted the way you even looked at things in your profession.
I sort of share this a bit with a bit of embarrassment, but at the beginning of my career, I didn't like working with children. And, I would sort of attribute that to being, young. I was in my early 20s. I didn't have children myself. And so I would just say, I would rather work with the adults. But later on, even when I had children and had been teaching and, supervising, I still didn't enjoy working with kids. And then I told myself it was because my passion was working with the parents and working with the adults. Now, that part may have been true, but I actually remember the moment, Amanda, when this particular slide and all that is encompassed in what you just described hit me. And I thought, this is why I've never wanted to work with children. I wasn't effective. I could not help them. So the things that my training would do is largely targeting here and somewhat the limbic system, but the connectivity between those two, when it's not in place, no amount of practicing coping skills and reviewing what just happened and then practicing when it happens again, none of that was effective because they didn't have the connectivity that would be needed when the difficulty or the dysregulation presented itself again. So understanding that actually the work begins in that low brain, works to the top, just like the brain develops, and then works from the back and then all the way to the front. My therapy work is brilliant here.
Yeah.
And it can come alongside when a child has that connectivity. They have to have those reflexes integrated first, and they have to have those neural pathways laid before the child can begin to learn to emotionally regulate, to be able to identify and handle big emotions and respond in ways that are age appropriate. So this was a transforming piece of the puzzle for me that helped me to see how my previous, and in ongoing professional life would blend beautifully with brain balance. I didn't need to choose one or the other, thank goodness. They go together.
Yeah. And I think that's where, you were talking about the boarding school and when you were watching and supervising the cases of half of the students doing brain balance and half not, the goal and the role of brain balance is to create a brain that's teachable. The better connections and the better processing that you have in the brain, the more the brain is teachable. And so again, that ability to be able to self-reflect, that ability to be able to learn from the choices that they make is really critical. It's really critical. And so many times, one of the questions I want to ask you as a parent, is to reflect on, does your child learn from the mistakes that they make? Or are they making the same mistakes over and over again? Because that is a sign and a symptom of a disconnect that's taking place in the brain, where there's maybe some underconnections that's inhibiting the processing in the brain. And so when we look at and we assess children in our centers, we want to look to see, do they have primitive reflexes that's inhibiting development? And then we look at their sensory processing, their visual system, their auditory system. We actually look at smell. We look at their ability to physically feel their body, because all of that gives us insight on how their brain is functioning. And then the way the brain also develops is not only through your child's sensory systems, but also through their motor systems. So we look at muscle tone, we look at gross motor skills, we look at coordination, body awareness, balance. I say to my families all the time, a coordinated body equals a coordinated brain. So motor functions and coordination is really critical and key. If we have if we have an uncoordinated body, that's a sign and a symptom of an uncoordinated brain. So gross motor is important, fine motor is important. And then just like you were sharing, Dr. Robertson, the frontal lobe, well, the visual system and the small motor movements of the eyes are really critical for the development of the frontal lobe. And so oftentimes we can see and we can look at where's your child's strengths in brain function, and then are there any underdevelopments in any of these areas that could be impacting the cross communication of the brain? So I often say, again, a connected brain is a teachable brain. A balanced brain is a teachable brain, because we have to look at things from a developmental perspective, but then we also have to look at things from a hemispheric perspective. And this is when we look at left brain versus right brain. Left brain is the gas pedal. It's like a gas pedal. It's your processing hemisphere. It's memory. It's remembering facts and details and verbal communication and linear and logical thinking and IQ and pattern recognition. All of that is left brain. But then we have the right hemisphere of the brain, which is like the brake pedal of the brain. It's your ability to stop and think before acting. It's those nonverbal communication, reading facial expressions, the ability to see the big picture, what we call global coherence. Again, gross motor skills, muscle tone is housed in the right hemisphere of the brain. Emotional EQ, so social skills, is housed in the right hemisphere of the brain. The ability to be flexible, the ability to control impulsivity, the ability to physically feel your body, and that's the foundation for the development of empathy. So here we have left brain, right brain, and really we need both hemispheres developing equally. They need to be able to cross communicate and constantly communicate, and that's how we build a connected brain. Many times we see children, and I want to ask parents, think about this. Do you feel like your child has extreme strengths in certain areas? And then yet, like, for example, I'll have parents say, I feel like there's times I'm talking to a lawyer, and then there's other times I'm experiencing a toddler. And how in the world can my child be on both ends of the spectrum? Like extremely bright, extremely brilliant in a lot of areas, and then yet struggle with some basic things like getting dressed and getting out of the door on time. So share with me, Dr. Robertson, looking at this, and again, your perspective of, really understanding those hemispheres of the brain and the need for, like what you're saying, you're working on you're working on needing cognition, you're needing that self-awareness. And so again, what is your perspective related to this?
So I have a personal example. I have two children, both of whom have gone through the Brain Balance program, and they both meet the criteria for ADHD. The difference is I have one that struggled with a gas pedal, and I have one that struggled with a brake pedal. And both met the diagnostic criteria. So my kiddo with that left weakness was but at the time was a very sweet child, and teachers loved him. He got along well with peers, but the challenge was he couldn't get motivated. He couldn't stay task focused. Mm-hmm. He would hear the first part of what was being said, but that was it. He couldn't really follow sequential linear thinking, so he would struggle with completing tasks. And on the other hand, my right brain weak child talks, learns many things about topics that are of interest to him. He right now, even now, can tell you how to build a computer. He's 12 and a half. He can build a computer from the ground up, and he will tell you about it. And then at times, if you ask him, how are we doing with our 6th grade math? He's like, deer in headlights. So these both play themselves out, and we see this with parents who are like, what do I do with my child? How do I help them with this type of struggle? And especially when you have one of each, it's very interesting. So my work with parents is to help them understand where these children are struggling and help support them to grow the connectivity in the areas of the brain that is needed so that they can function. Both of my kids have been through the program, and they're marvelously transformed. I've been able to brag on my 15-year-old who's now employed. He got his very first job. He's loving it. He's tracking well, and seeing his transformation across the last few years has been amazing to watch. Because we're here to grow adults, right?
Yes.
That's our parenting job.
Mm-hmm. Absolutely.
To make sure that our kids can grow, they can take care of themselves, they can be happy, functioning, and do what they're capable of doing and do what they want to be doing. So it's incredibly important.
Absolutely. And I think you bring up a good point. and I know we talked about this before, where, 10 years ago, it was really split into two diagnostic, criterias, right? You had ADD, and then you had the ADHD, and the HD was more of the hyperactive impulsive. And now it is one diagnosis. But I also think you bring up a good point that there's motivation, which is really important for the left hemisphere of the brain, and the right hemisphere of the brain is about follow through. So many times we'll serve children that they have incredible, goals, and a lot of motivation to go after goals, but then yet they can have weaknesses in follow through and having to do all of the little steps, right, to get to that final goal. And so, so just like you were sharing, is that children with more of that ADD, it could be that they're just low in motivation. And then as they become teenagers and go into adulthood, they would be more susceptible for that depression, because again, that lack of motivation and just having kind of that ho-hum, woe is me. But all to say that you really need both hemispheres of the brain cross-communicating, developing equally and efficiently. And, of course, we were joking earlier this afternoon that, there's probably not too much longer we're going to be able to use this analogy, but there's a lot of parents out there that grew up with the development of the internet, right? And so it could be that when we're trying to talk and understand an imbalanced brain, there can be areas of your child's brain that's functioning more on dial-up, and there can be areas of their brain that's functioning on Wi-Fi, right? And so because they're operating on different speeds, they're not able to effectively cross-communicate. And therefore, we get this imbalanced brain, we get this imbalanced skill set. And then that's when you have those moments where you're talking to the lawyer or you're dealing with a 3-year-old meltdown.
Absolutely.
So here's the next poll question. Do you feel that your child or young adult has both significant strengths and weaknesses that seem to be causing the disconnect, that it's prohibiting them from reaching their full potential? Because like we just shared, this is very common that we hear. And yet, hopefully, by understanding a little bit more about brain development between the developmental perspective and the hemispheric perspective, hopefully this makes a little bit more sense to you, perhaps why your child may be struggling. Another thing I often ask parents to look at is, other symptoms that you may not even consider. Like we were talking about motor skills and gross motor skills and coordination, or we were talking about the visual system related to focus and attention. So there's a lot of other symptoms sometimes that can be present that you might not have ever considered, but that are also signs and symptoms of underdevelopment in the brain. So let's see what you guys have to say. 96% say yes. And so I'm so happy that this makes sense for you, because again, we want you guys to walk away tonight with some nuggets, and so that is definitely something to consider, that there's an underlining cause for the symptoms that you're seeing. And it can be or could be underdevelopments in the brain that's impacting the cross communication of the brain. Now in Brain Balance, we're celebrating our 15th year anniversary this year, and we've been talking about developmental age and brain age for years. And yet it excites me so much when we start seeing research really supporting what we've been talking about. Dr. Barkley, who does a lot of research in ADHD and self-regulation, says that children with ADHD can present up to 30% behind developmental milestones socially and emotionally, regardless of their IQ. So again, thinking about what we just talked about, left hemisphere IQ, right hemisphere social and emotional development, that when there's this disconnect taking place, it can impact social and emotional development. And then the other piece that I thought was really interesting about this research is that it's basically, we once thought like, oh, well, maybe my child's going to grow out of it. Well, what the longitudinal studies are showing is that actually that's not really the case. The imbalance can become greater as the child gets older, and the symptoms can just look different. So I know, Dr. Robertson, we were talking about that earlier.
Yeah.
You serve the adult population. What do you
Yes.
experience related to adulthood with ADHD?
I think about my work as I do a lot of work with marriages, and there's not any, working especially with those who are married to or in long-term relationships with adults who meet these diagnostic criteria and have been untreated for the entirety of their lives. The pressure that generates for the significant other is enormous. And I work with the other spouse who is carrying the weight of remembering birthdays and dentist appointments and to bathe children and to feed children and to go to the grocery store. And because the inability of that significant other who has these same struggles, they don't remember those tasks. They've not addressed those underlying connectivity issues in their own brain. So then the weight of that on their partner is immense. And that's, if I'm honest, that's where I have done the majority of my work, is in relationships with those sorts of imbalances, with one partner carrying the weight that the other partner cannot.
Mm-hmm. Absolutely. Yeah. So again, and that's the thing that even the research talks about, is how it affects relationships and affects careers.
Yeah.
And so, yeah, it makes total sense. Also, Harvard has done a study specifically on brain balance at McLean Hospital, which is a research hospital run by Harvard. One of the areas that they're really looking at is holistic options for families, looking at more of a non-medical approach to address these root causes. And so Dr. Teicher, who's leading research over there specifically about the Brain Balance program, his findings have shown that it's as effective as stimulant medication in alleviating ADHD symptoms in children. And that's a big deal, because a lot of times there's, parents are coming in trying to be motivated, that they're not wanting to, do medication. And of course we say there's a time and a place, for medication. It's not all or nothing. But it is encouraging to think that, yeah, there can be other options out there, holistic options, that we can improve brain function, we can improve brain development, and we really can address the root cause of why children are struggling. So at the end of the day, really with all of the research that we're presenting and with everything that we're talking about, what's really going on is that if a child is struggling with behavior, focus, memory retention, academics, life skills, social skills, it really comes down often to a lack of brain connectivity. And that's what the research is showing, is that when there's underdevelopments in the brain, it impacts the cross communication of the brain, and therefore you can see children respond out of, the downstairs part of the brain, where they're responding out of emotions versus areas of reasoning and critical thinking. So the good news is that we can strengthen brain connectivity. The study of neuroplasticity that says that the brain can change all the way through adulthood. And that's why we have launched an adult program in the last year and a half, because that is the point, is that we can improve the function of the brain, no matter if it's a child or an adult. But of course, in children, your imbalance most likely will be less, and their brain is growing and developing rapidly, which is awesome. So always the question is, okay, well, how do you do this, Amanda? How do you strengthen brain connectivity? Well, we look from a developmental perspective and we look from a hemispheric perspective. We want to activate multiple sensory inputs simultaneously with increased intensity over a period of time, because that's what the research says. We want to improve their sensory systems, we want to improve their motor systems, but we also look at things from a hemispheric perspective. And that's what makes Brain Balance very unique compared to other programs, is looking at things from a hemispheric perspective. Now, again, we want parents to be able to walk away with some tips and strategies of how to activate your child's brain, even at home. And it's summertime. So, summertime, I have parents that are like, Amanda, we are so glad it is summertime. Woo, we're not getting the notes from the teacher right now. You know, I can look at my phone and not hold my breath because I'm not getting dojo remarks, which here in the South, we have this dojo system. And I don't know how the teachers can do it, but they send messages constantly to parents, giving them updates on their child via this social media platform. But all to say that, you know, I call it, my background's in behavior, and I call it setting events. So one of the things we want you to think about is, what are some pitfalls to avoid, or what I call setting events that can impact or cause a meltdown? So of course, the first one, when we were talking about how, you know, we assess to look at, does the child physically feel their body? Many times children that have underdevelopments in the brain, they may not physically feel their body well. So that's where they don't know when they're hungry. They don't know when they're thirsty. They can undereat, overeat, picky eat. We see it all. And so one of the things you want to think about is dehydration. Are they hydrated? Are they drinking enough? Because this is something that, again, could be a setting event that could cause them to not be able to function optimally. And then Dr. Robertson, I know you talk a lot about schedules and also screen time. So give us your input on that.
Well, I do have to say something about the dehydration. I think thanks to stickers, we've all learned the impact of being hangry. So we tend to, you know, pay attention more, like, has my child eaten? So I chuckle about that. So I love this tip because we can overemphasize, have they eaten? And we can forget, have they had enough water? And there's a significant impact to brain functioning related to hydration. So that's why I love having that on here. Related to schedules, you know, depending on the families listening tonight, you might think that you are an overscheduled family. You might feel like you're an underscheduled family. I'll let you decide that for yourself, but thinking about consistency, we get to the end of school and we're like, whoa, oh good, we don't have to go to bed at any particular time. We don't have to get up at any particular time. So we do want to keep our kids on a schedule. It doesn't have to be rigid, but we want to help them have structure. This helps them manage those emotions until they can handle them well. We want to make sure that they know what to expect so they can feel safe. It helps to decrease that poor behavior. Then screen time, and I'm really looking at myself on occasion too. I like to watch shows on Netflix when I'm bored, but screen time has a negative impact on our brain. And I know we're going to talk about this later, but my favorite thing in the world to hear from my children is, I'm bored. It's marvelous to be bored. It's amazing to be bored. Get off the screen and be creative. What do you do when you're bored? And so screen time can circumvent that process, and it has a whole lot of other negative impacts that we're just only now beginning to understand, especially on the developing brain. It's not good for any of us on the call tonight, but it's definitely not good for our developing brains.
Yeah, absolutely. Absolutely. So these are some things for sure to think about. And also too, if they're having meltdowns after the screen time, that's a red flag for sure.
Yeah.
So yeah, thanks for sharing that. And I think that's really important to think about, is these are more of what we call setting events. And then here's some helpful handouts. We're going to throw this up in the chat. You're going to get an email with this. But these are some things that you can do at home to activate your child's brain. All right. The thing that I love to talk about is the motor maze. And literally you can cut these little blue, pieces of paper out. And then you put them around your house. And you have your child go run and find, it's almost like a scavenger hunt, to go run and find all of the little clues. Now, little do they know that it's a lot of physical activity, okay? But big motor movements and physical activity fire the right hemisphere of the brain, which is actually the area of the brain to promote calm, to promote focus and attention, and also to be able to handle, changes. So that is why we really promote physical activity, because it actually does activate specifically the right hemisphere of the brain. And then, of course, the other element is the free play and creativity ideas for you. So many times we as parents, we provide a lot of activities and a lot of things for our children to do. Then all of a sudden they say the famous words, I'm bored. Mom, I'm bored. Dad, I'm bored. Well, boredom is actually awesome for the brain, because it requires them to have to get creative. It requires them to have to think. It requires them to have to dig deep into that, just imaginary play, which is very right hemispheric. Being able to give them a group of supplies and them have to create and develop something on their own is very right hemispheric. So I highly recommend, there's lots of fun ideas and activities, especially right now during summertime, where you can address the boredom in a positive way that actually can activate their brain. And then Dr. Robertson, I'm going to pass this one on to you since you are the family and marriage therapist. But talk to us a bit about family core values.
I love, this is my favorite part, and I know we're mindful of time, so I'm going to give enough here to hopefully interest parents. I could talk for a very long time about it. Early on in my training, I learned elements of this related to blended families. So we talk about families that come together and, they maybe one partner had children from a previous relationship or perhaps both, and they're coming together. We call it like that blended family. And I was trained in helping those families create a family that is new and together. I worked with a family early on. I've changed their name here, but their actual last name was Champion. Again, not their real last name, but their last name was Champion. And they used that name as a way to ground what they wanted to be about as their new family unit. And out of that, they grew a sense of what they wanted their family to be about. Now, what I've realized in the 20 years plus of working with families is that's not just something that's applicable to blended families. In fact, it's really sad if that's the only way it's viewed, because families are coming together, all individual brains, everybody's got their own set of thoughts, and developing relationships. As parents, being able to work with your family system, inviting your children in, and creating something that is of value to you. And so in that handout, you're going to see, using acronyms as ways to talk about things like we value respect, we value trust, we value patience, whatever those things are that you want to be about. It's less about behavior and it's more about the value itself. And what that does, again, collaboratively, created as a unit, gets buy-in. So then it's less about I can't do this and I have to do that. It allows each member of the family to reflect on their own behavior. How is what I said to my sibling a reflection of respect? Mm-hmm. So it invites their own ability to reflect. It also allows parents to teach behavior, not from the standpoint of rules. Do this, don't do that, those shoulds. It teaches how to engage around the value or the importance that families place on it. That is a whole different way to shape a child's understanding of their place in a family and the way they interact with others. And it creates opportunities for them to self-reflect. Of course, as they age, 4-year-olds don't have a great capacity to self-reflect. So we see that mature, we see that grow as they mature. So when, I would encourage parents on tonight, when you get the handouts, there's actually a link in the DIY Family Core Values page. Go to that page. Look through the different areas, thinking about what are we about and why, and shape that narrative and that story as a family. It will transform you. And if you've decided as you listened, we might be an overscheduled family, that's okay. Balance that with time together. You can be overscheduled. Also make sure that you're investing in your relationships at home. And it doesn't have to be about the next tennis tournament all the time. And it doesn't have to be about the next academic, spelling bee. Also be about relationships. That's both hemispheres.
Yeah, that's great.
I could go on.
I know this is your soapbox, but yeah, this is great. And I think it also shifts that whole I'm bad perspective, and it's really calling the child up, like you're saying, to the value, and it's teaching them the values when things are calm and when things are good. That's really when teachable moments is when children are not in fight, flight, or freeze. They're actually using more of the upstairs part of their brain, which is reasoning and comprehension. But their nervous system has to feel safe and secure to be able to reason and comprehend. And
Amanda,
yeah.
Oh, sorry. I was going to say I'm from Kansas. I live here in Kansas, and that's why we do tornado drills when it's sunny outside. That's why we have the sirens on, so we can hear them, because during a tornado is not the time to figure out what you're going to be doing. So we need to practice those in those safe, calm times. So when the storm comes, literally and metaphorically, each member knows, and they've practiced, we've been through, we know what our drill is, we know how we can regulate ourselves, help regulate each other, we know what to do.
Absolutely. No, that's great. That's great. That's a great metaphor as well. So I hope that this is helpful for you as a family. And again, it's just the beginning of some ideas for you. Here's the next poll question. Which strategy do you feel like is most helpful for you and for your child or your family that's struggling? Is it the maze, the motor maze? Is it the free play and creativity, or the family core values? Or maybe it's all of the above. We want you to be able to take one or two things. Don't get overwhelmed and think, oh my gosh, I have to do all these things. But really, what are you taking back after this webinar, that can motivate you and help your family? So let's see what you guys have to say. Okay. 63% say all of the above. And then we've got the motor maze and we've got the family core values. So that's awesome. Many times parents will say to us, oh my gosh, and we already said this and we addressed this one time, right? It's like, Amanda, we've tried everything. We've all tried the parenting tips, all of the strategies, we've done it all. And yet my child is still struggling, yet we're still struggling as a family. Well, I really encourage you that the next step to engage with brain balance is just to get answers why your child is struggling. And the way that you get those answers is through our comprehensive assessment. We look at primitive reflexes. Does your child have primitive reflexes that can inhibit brain development, that can cause them to function out of fight, flight, or freeze? We also look at their sensory systems, their visual system, their auditory system, their motor systems, their ability to smell and feel. We look at balance and body awareness. We look at coordination of their body. We also look at things from an academic perspective as well. How are they reading? What are their visual, what does their visual system look like compared to reading? We also can look at things like what we call executive functioning skills. We have this assessment tool that really looks at their independent skills, their ability to plan, to follow through, really looking at those cognitive elements of brain function. So it's a very comprehensive assessment that we offer. And if you participate in a webinar, we actually offer a discount on the assessment. We can give you $50 off of the assessment. What you would need need to do is either call one of our centers, or if you've been texting with one of the centers while we've been presenting, they are here to book an assessment for you. And that's the next step. It's really to look at, where is your child functioning? Where are their strengths in brain function? And where are their weaknesses that can impact that development, that can impact the cross communication of the brain? So this is definitely the next step that we encourage you to do to get more answers. I really hope that this presentation has been helpful, and that you're able to take away, just some nuggets of a better understanding of perhaps why your child is struggling. Now, we did pretty good this time, Dr. Robertson. It's 9:04 Eastern time.
Yes.
This afternoon we went about an hour and a half, so we had to kind of reel it in. But, I think we have a few minutes. I would love to answer some questions of people that may have a specific question that could be helpful for us to answer. So I'm going to let our moderator take a look at the questions. If you've got a question, you can, text it into the chat and ask. And we would, of course, love to be able to answer a few questions. One question I did see was it looked like a mom was talking about they had an adoptive child, and that child had been through foster care. And one of the things that we do see, we actually serve a lot of children that are adopted, a lot of children that have been in foster care, and many of them are diagnosed with ADHD. But I often encourage parents to look a little bit deeper, because ADHD can be, the symptoms of ADHD can be presented, but the root is really anxiety. It's still the same root, which is underdevelopments in the brain. Probably the child has primitive reflexes, but trauma can impact brain function and development. And so when children change homes often, and have been in multiple foster homes, absolutely that can impact brain development. But it also can, you really have to look at, are they really ADHD, or are they just so dysregulated and their little nervous system is in a place of anxiety? So I think that's important to consider and to look at, because that is definitely something that we serve many families with. All right, so are there any special questions for us tonight?
Thank you, Amanda. So one of the things that we've seen come up a few times in questions throughout the presentation is really just talking about kids, as well as through college age, even adults, who really show those great strengths in some areas, but then also have some significant challenges. Some people want to know, what is it that really creates those incredible strengths, and why is it that sometimes the weaknesses don't show up until much later? Sure.
Well, there's a few things that we have to think about. There's environmental factors. If we think about the last 10 years, our ability to be on screens and social media and, all of the different technology pieces that we have is very different, even just in the last 10 to 15 years. And the research does show that long times on these devices can impact brain function and brain development. It can actually develop the area of the brain specific for addiction, so it's stimulating certain areas of the brain that can cause an imbalance. So that is definitely something that I think, considering into adulthood, that's an environmental factor that has definitely impacted adults. And then the other piece too is that, again, as a child grows and develops, we have a whole presentation on this, but the conversation around executive functioning skills, which is basically independent skills, and so as a child becomes a teenager, one of the signs and symptoms I share with families that have teenagers is that if your teenager is not excited and preparing to drive, that is definitely a red flag of underdevelopments in the brain. If you really think about, the way we grew up, right? We counted down the days to get our learner's permit. We counted down the days to get our driver's license. We begged our moms to let us out of school to go get our driver's license, because there are developmental milestones outside of just motor development. There are developmental milestones towards independence. And so if you're seeing where there's some red flags of your child not showing interest in driving, that is definitely a little bit of a red flag. Well, not a little, I would say a big red flag for the area of independence. And so as the requirement for independence grows, as the child becomes a young adult, many times you don't realize as a parent how much you've done a lot for your child, and you have helped them get through. And yet it comes to a point where they're 18 and you're kind of like, okay, why are we not where we need to be? I've done all these things, and yet you're not there. So those are some things to consider. I don't know, Dr. Robertson, do you have any other perspectives as well?
Yeah, I would add really what you kind of identified right at the end is I was guilty. My husband and I were guilty of this even for a while. We just sort of go on autopilot, and even though our children were maturing, we were not maturing our parenting accordingly. So we continued, especially with our first, because they don't come with instruction manuals. I was quite disappointed to learn that we were still doing for our children things that they had the capacity to do themselves. So we recognized we couldn't really autopilot our parenting, and we had to adjust accordingly. And we've started, we continue that as they age, little simple things, not even just like unloading a dishwasher or doing their own laundry, even things like ordering out a restaurant, not ordering for them, beginning to grow their confidence in those tiniest little ways. Sometimes they'll say, hey, stop ordering for me, but sometimes they don't. And so recognizing, being able to grow their independence. We happen to have gone on a trip for spring break, the first time my kids have flown in years. We sent them right on up ahead at security with their little passports and walked them through what to do. And we stood back and, getting them comfortable doing things as they mature in age. And of course they were terrified. We did it with support. We didn't shove them out and say, good luck. We did it supportively, but we helped them manage that anxiety and grow independence.
Mm-hmm. Absolutely. I think that's a brilliant and definitely an important point for sure, is changing your parenting style or growing as they're growing. Yeah, that's great. Yeah. The other thing too is that, I see that there's several questions around I had to chuckle for a minute. My man child is 21 years old. I had to laugh at that one. But, can we speak to 21-year-olds or 20-year-olds? And absolutely, just because they're chronologically 21 or 22, it doesn't mean that developmental age is matching their chronological age. And so we absolutely serve that age group in all of our centers. Every center will serve a young adult up to 24 years old. And then we do have certain centers that are offering the adult program. And here's the cool thing, is that Brain Balance offers multiple programs. So we have at-home virtual programs, we have in-center programs, we have programs that can fit every family's need. So definitely, reach out and, ask and ask for help and really get answers. The first step really is to get that assessment. Any other specific questions that you feel like we should answer?
Yes, we have had several questions about other diagnoses like sensory processing disorder and fine motor skill challenges and learning disorders, and parents that also see these ADHD symptoms in their children with these other disorders. Can you explain how brain development ties all of those pieces together?
Sure. Well, it's one of those things where We absolutely can serve multiple diagnoses. So really, in the world of brain balance, we really don't care about the formal diagnosis as much, because we are looking at things from where's your child's strength and brain function and where are their weaknesses that could be causing the disconnect. So in our world, we're not really hung up on the diagnosis. We're really looking to see, is there an imbalance in skill sets? If your child is functioning at a certain age appropriate level, or even above their chronological age in certain areas, that's really where their potential is. And so what we know now through all of the research is that if a child is functioning at a certain skill set in some areas, they have the potential to be able to function in all areas at that age level. So that's what we're really about, is we're really about connectivity in the brain, optimal synchronization in the brain, so your child can meet their optimal potential. So that's a great question.
Thank you. I think we have time for at least one more. And the other most common question that we've gotten is, how do you determine what behavior is a choice and what behavior is not a choice, specifically related to our kiddos that behave so well around other people, but then struggle so much at home?
Yeah. All right, Dr. Robertson, I'm going to volley this one to you.
Yeah. I want to take this one. In fact, I just had this conversation with a couple of my brain balance staff. How come this child, mom and dad wanted to know, this child is wonderful at school. They can hold everything together. The teachers love them. They're not a behavior problem. And they get in the car and they close the door and vomit everywhere, metaphorically, all over, siblings, parents, and how are they able to do that? That's got to be because they are choosing to dysregulate at home, or they're choosing, if they can do it at school, they can do it at home. My processing this is to help them understand, in order for your child to manage in those situations where they're at school perhaps, or they're around other people and they can hold it together, please understand there's a little, we talk about white knuckling something. So you know how you can just sort of keep at it and your knuckles start to just grip and keep at it and your knuckles turn white. To some degree or great degree, your child's physiology is doing that in those settings. They are holding it together until they don't have to anymore. The amount of energy, the amount of what demand is pulled on their body and their brain to keep it together can only last for so long. There's also a backdoor compliment to parents, is that also means you are safe. If they feel like they can pull those big emotions out, and I understand it's not loving, they feel safe with you. We don't want that to be okay, right? But that's why they're doing it. They're white knuckling to some degree in those settings, and they just can't hold it together forever. Does that make sense?
Oh, absolutely. Absolutely. And I 100% agree with that. And we do. We see that over and over again. All right. Well, we don't want to keep you up all night. So again, thank you so much. Now we are going to have a survey at the end of this presentation. When you click off of the webinar, a survey will pop up. I really ask you, please fill it out for us. We want to create webinars that are helpful, useful, where you're taking information and utilizing it. That's what we're here for. And I really hope tonight that you're walking away from this webinar recognizing my child's not bad, I'm not a bad parent, and perhaps there's some underdevelopments in the brain that's impacting my child's ability to function optimally and be able to reach their full potential. And yet, the hope and the answer is that we can improve the function of the brain. So thank you so much for joining us. Thank you, Dr. Robertson, for being up late with us tonight. And I really, really hope that everyone is taking away just a piece of encouragement, a piece of information that can be helpful for you, your child, and your family. Have an awesome
Thank you, Amanda.
night. Thanks so much, Dr. Robertson.
Good night.
Good night.
Good night, everyone.
Good night.